Hi, everybody. I'm Tracy Gaudette, and welcome back to the Whole Health Story. Today, I'm going to focus on helping clinicians understand how they can use the Whole Health Reflection Tool every day in their practice. And if you don't have that, you can download that by clicking on the link below or the link in our bio. So just to remind everybody, this is the Whole Health Reflection Tool. And I know a lot of clinicians feel like it's too much to change the whole conversation with my patients. I don't have time. So I wanted to just give you a couple of pointers practically about how you can utilize this tool where it will not overburden the flow of your clinic. So the primary thing is to give it to people to take home and fill out, or if people are in the waiting room, give it to them in the waiting room and help them understand this is not a medical information piece, it's a self-reflection. So they can get as far as they want to, answer what they'd like to. And you, likewise, can pick up where you would like to. I think the thing that I would reference to you, the first page of this, as you guys remember, is a self-guided reflection on how is it in my physical well-being, my emotional well-being, my spiritual well-being, and then how is it to live my life day to day from miserable to great. I like to think of these as vitality signs. We have vital signs when people check in for their clinic appointment, they get their vital signs taken. I would love to see, and one thing you could do is have your techs, as they're doing vital signs, just run through these questions if they'd like to, and just say, we ask people pain scales, ask them these scales instead. And what this adds to your practice is it's a quick screen where you can look, if somebody says, it is miserable to live my life day to day, that's going to change your conversation. We actually developed these signs in the VA when, sadly and tragically, we missed a patient who was suicidal because we were asking them medical questions, but we weren't really finding out, was he suffering? So these are great and can be incorporated not even by you, but by your med tech. When they're doing blood pressure and weight and stuff, we have three or four quick questions, 1 to 5, give us your answer. So that's one way to utilize it, or the patients can fill it out themselves. The next piece of this, I would like you to think of as a whole health review of systems. And this is the area of self-care where people rate where they are currently and where they'd like to be. So on a scale of 1, we're like miserable, to 5, great, awesome, optimal. Where are you in these different areas of self-care? And you can have patients fill this out. It can be very quick. And it's a wonderful tool both for people to gain greater awareness of their own self-care, but also for you as the clinician. And I want to close by sharing one quick story about a physician. She's a primary care physician and internal medicine doc in the Boston VA. And she shared a story with me about seeing a veteran, in this case, who had filled this out. And she said he came in as presenting a complaint. Chief complaint was knee pain. And she said, Tracy, I was working him up, doing everything I needed to do to address his knee pain when my eyes fell on this. And I noticed in 2 areas, one was relationships, and one was power of the mind, where he had said where he was now was a 1, the lowest possible score. And she said, I went, oh, that's not good. And she said, so I stopped my workup on his knee pain. And I said to him, I noticed that you have rated these a 1. Can you say more about that? And he broke into tears and sobbed and shared with her that he suffered a lot from post-traumatic stress and TBI, traumatic brain injury, and how he just couldn't get through the days anymore. And she said to me with tears in her eyes that she would have missed that whole thing, doing what she thought she was supposed to be doing, working up his knee pain. So that's just a powerful illustration of how these simple tools, in addition to vital signs, try vitality signs. And in addition to your review of systems, perhaps try the whole health review of systems. It can really make a difference and change the conversation and change the outcome. So I hope you'll give it a whirl and let us know how that works for you.